Hi, Deanna.
So, first off, I don't have a goniometer, so I'm going to try my best to do this correctly without a measuring tool. So, my dad is my partner, and the first one we're going to do is wrist flexion. So, my partner is going to stabilize his forearm with his elbow down and his wrist straight. The axis of rotation is going to be the triquetrum. And the stationary arm is going to be the ulna, so right there. And then the mobile arm is going to be the fifth metacarpal, which is the pinky. So it's the line for the goniometer would be like right there. So then he'll be doing this motion. So I will be measuring with the mobile arm this way. So my partner is going to just extend his wrist as far as he can. And I would guess that's about an 85, which is the normal one for the wrist extension. And it's in the sagittal plane. So that is the first one that I did. So for the next one is going to be hip external rotation. So my partner is going to move a little bit so we can get situated here. So for this one, he's going to sit back so his legs are dangling. And I'm just going to move this over here a little bit. Okay, so I'm going to instruct my partner to move his heel as far as he can immediately, but I'm going to make sure he's not lifting his leg off of the table so he gets a large range of motion. So the axis of rotation is going to be the anterior patella, so about right here. And then the stationary arm is going to be perpendicular to the floor. And the mobile arm is going to be the alignment with the anterior crest of the tibia. It's about right here. So when he moves his leg immediately, I'm going to hold the goniometer right here while he immediately external rotates and measure about right there. The normal is about 45, and I would say that's maybe 40, so he's a little shy on the 45, I would guess, on that one. So that's all for the external rotation. So next I'm going to do the cervical flexion, so he can just stay there. But I'm going to do it with a tape measure. Okay, so he's going to flex his neck downward to his chest, and I'm going to measure from his chin to his tibial crest, or his crest there. And the normal is 1.0 to 4.5 centimeters. And his is pretty small. Looks like it's about maybe 2.5, 3. So that one's pretty easy. All right, so now we're going to move on to the manual muscle test. So for this one, I'm going to get behind my partner. My partner is going to sit on the chair with his legs dangling. I'm going to stand behind him like this. I'm going to put both of my hands on his shoulders. And when I instruct, he's going to shrug his shoulders up, and I'm going to resist down for about 3 seconds to test his strength in his trapezius. So go ahead. And that's strong, so I would give that a good 5 on that one. So the muscles involved are just the trapezius, but I did the upper trapezius on that one. The plane of motion would be the sagittal, because it's going upward. The origin is the external occipital, so in the back right here. And the ligament nunace, can't really say that. And the spinous process C1 to C7. The insertion is the lateral end of the clavicle. And the actions are scapular elevation, upward rotation, lateral flexion, and collateral rotation of the neck. So now we're going to move on to the lower of the manual muscle test, and that's going to be the gastrocnemius. So he's just going to stand up, and I'm going to come up in front here. So he's just going to stand, and he can hold on to the chair or table if he needs for balance. And he's just going to lift his heels off the ground into plantar flexion. So he's going to go onto his toes as far as he can. I'm going to count how many he does, and then I'll give him a grade based on that. So let's see how many you can do. he's struggling a little bit getting on his toes. All right, so he said he's good, so that's about 10. He went mostly on his heels. So grade 4 would be that one, because that grade 4 is 10 to 24, sorry. So the muscles involved is obviously the gastrocnemius. The plane of motion is the sagittal. And then the origin of that would be the superior, medial, and lateral femoral condyles. So just up here on your knee, back there actually. And then the insertion would be the calcaneus. So back here, can't really balance. And then the action is just like knee flexion and plantar flexion. Okay, then we're going to take a field trip to the couch. Okay. So my partner is going to lie prone on his back, if he doesn't know what that is. He's going to hold the couch the best he can. It's kind of hard with the couch, but okay, I'm just going to lay with that right there. So I'm just going to pull on his leg to test his quadris lumborum, which is in the back right here. So I'm just going to lift a little bit, try to move your pelvis up to your ribs, try to extend yourself. And on 3, I'm going to pull your leg. Nice, that's pretty good, so I'd use that a good 5, good strength on that one. So the muscle is the quadris lumborum. Can't really say that either. The origin is the transverse process of the lumbar spine, so L1 to L4, and the ilolumbar ligament in the posterior of the iliac crest. The insertion is the inferior border of the 12th rib, and then the actions are it fixes the 12th rib, and then it also helps with respiration and lateral flexion of the trunk. I think that's all I have. I hope you're safe, Deanna. Thanks.